Hello everyone, my name is Ahmed. I'm one of the R2s in the radiology department, and I'm happy to present this case of a 50-year-old female with thumb pain and imaging features characteristic of a glomus tumor, which is a mesenchymal neoplasm of smooth muscle cells similar to glomus body cells. So our patient had been having thumb pain and cold sensitivity for the past 10 years, and her symptoms began to worsen over the past few years. She also reportedly had a nevus overlying the area of pain, and this nevus had not changed in size, color, or shape. Of note, she did have a shave biopsy performed of the nevus, and it showed an intradermal nevus, which was felt to be unlikely related to the patient's pain. She had also been using topical Voltaren gel for symptomatic therapy with only mild relief. So initial imaging workup included an X-ray, which you can see here on the bottom left of the slide, which showed an ill-defined lucency in the distal first phalanx. Further workup was performed with MRI, some of which can be seen here in the top row, and the findings on the MRI showed a small, mildly lobulated subungual mass in the distal first phalanx with lateral enamel and intraosseous extension. This mass was iso-intense to muscle on T1 weighted images and hyper-intense on T2 weighted images. Post-contrast images showed intense contrast enhancement within the mass. And so these findings overall are fairly characteristic for a glomus tumor. So just some information on glomus tumors in general. They are vastly benign soft tissue tumors, which account for less than 2% of all soft tissue tumors. They are most commonly seen in adults, but they can occur in the pediatric population. The presenting symptoms typically include superficial lesions, which are painful and sensitive to cold temperatures, just like our patient had, and they also have a mean duration of 7.2 years on average. The patients report prior trauma in the area in about 20 to 30% of cases, and subungual lesions tend to be more common in women, whereas extradigital location is more common in men. And lastly, these lesions are treated with surgical excision and show a recurrence rate of less than 10%. And so that's all I have for this case. Thank you guys for taking the time to listen, and I hope you enjoyed it. Our emails are listed here below, and if you have any questions, feel free to shoot me an email. Thanks again.